Hello everyone, my name is Hannah Lee. I'm in DNP program at Maryville University. Today I'm going to present my DNP project. The title of DNP project is The Effectiveness of Interdisciplinary Teams Collaborative Care in Reducing Depressive Symptoms in Older Adults. Committee chair for this project is Dr. Maria Schnell. Second reader is Dr. Rita Wunderlich. Community member is Dr. Omid Musavi. The aim for this project is to find the effectiveness of interdisciplinary teams' collaborative care in reducing depressive symptoms in older adults. Older adults are at high risk of depression because they experience significant changes in their lives and lose many things. They lose a spouse, friends, job, vision, mobility, cognition, and so on. Those loss is replaced with loneliness, chronic illnesses, reduced physical function, and etc. The symptoms of depression in older adults are various. Patient Health Questionnaire 9, that is a depression screening tool, lists following depressive symptoms: sadness, hopelessness, guilty feeling, frustration, appetite problems, sleep problems, difficulty concentrating, fatigue, thoughts of dying. Because of complex causes and symptoms, the patients with depressive symptoms need to receive multifaceted care. Interdisciplinary teams collaborative care is type of multifaceted care. This project has a significance on reducing depressive symptoms, finding effective care for older adults, and finding the need of interdisciplinary team and need for collaborative care. Effectiveness of IDT collaborative care has significance for nurse, primary care provider, healthcare organization, older adults, and families. Nurses are prepared to assess patients in multiple dimensions, and they have critical thinking skills to find the needs and problems that patients have, and they provide holistic care. RN case manager can assess the problems and needs the patient has, and they interlink with specialists and patients to provide optimal care. So RN case manager can perform important role in IDT collaborative care. It is primary care providers' role to screen depression and identify depressive symptoms and treat the depressive symptoms. However, the primary care providers in current primary care setting find difficulties in treating depression in older adults. They need to receive multifaceted care, and primary care providers need to make referrals for them to see specialists. However, the referrals to specialists is not easy because the location of the office is far from where they live, and also there are shortage of mental health care providers. So there's need to be a transformation of the practice in primary care setting. DNP is prepared to be a primary care provider, and they are trained to be a transformational leader. So DNP need to provide care for patients in a primary care setting with IDT collaborative care. In order to do that, they need to transform the current practice. This IDT collaborative care is significant for healthcare organization. Reduced depressive symptoms will reduce hospitalization, and will reduce worsening of chronic diseases. This is cost effective and it can create health equity. And this IDT collaborative care can benefit older adults and families. So it is significant for them so that they can enjoy better quality of lives. Prior to conduct this project, review of literature was done to find evidence-based practice. The keywords was found in PICO question. PICO question is in older adults with depression. Does the collaborative care by the interdisciplinary team as compared to no collaborative care reduce the symptoms of depression post-intervention after 6 months of treatment? The keywords include older adults, interdisciplinary, collaborate, depression. The literature finding was limited to publication dates from 2014 to 2022. The initial search found 191,900 articles, and they were narrowed to 19 articles. Integrated review of literature was done on 19 articles. It found Patient Health Questionnaire 9, Interdisciplinary Team, Collaborative Care, Patient Outcomes in those 19 articles. 12 articles provided strong evidence of the effectiveness of collaborative care by multidisciplinary or interdisciplinary teams for managing depression in older adults. These 12 articles were re-evaluated for research integrity without fraud and meeting ethical guidelines. Theoretical framework that support this project are following. Carl Rogers' person-centered theory tells older adults must be assessed comprehensively and holistically, and it supports this project. Virginia Henderson's need theory supports this project by saying patients may find more independence as their needs are met. A collaborative model, that is patient model home, was reviewed and studied. In this study, physicians worked with interprofessional teams, and this care met various needs that older adults had and promoted self-care and independence and reduced the symptoms of depression. Another model is the PACE model of care. PACE stands for Program of All-Inclusive Care for Elderly. PACE program has IDT members, and all participants receive IDT collaborative care. IDT members are consisted of center manager, master level of social worker, primary care provider, RN case manager, physical therapist, occupational therapist, registered dietitian, activity coordinator, home care coordinator, personal care attendant, and transportation coordinator. IDT also collaborates with clinical social workers like SCSW, chaplains, and other specialists. This project was done at a community care center located in the southwest of the United States, providing a PACE model of care, serving age 55 or older with complex health problems. The interventions for this project was 6 months of IDT collaborative care. The design of this project is a quantitative exploratory design using retrospective chart review. The tool that was used for this project is a PHQ-9 depression screening tool. It asks 9 questions on eating problems, sleep problems, sadness, loss of energy, poor concentration, despair, loss of pleasure in activity, feelings of worthlessness, and suicidal thoughts. The PHQ-9 is a reliable and valid tool for depression screening, evaluating the severity of depression, and identifying the type of depressive symptoms to be treated. The PHQ-9 score expresses the severity of the depression in numbers, and this enables quantitative study to be done. Pre-interventional PHQ scores will be compared to the post-interventional PHQ scores after 6 months of intervention. A retrospective chart review will explore two sets of data, pre- and post-interventional PHQ scores, evaluated, and these are extracted from electronic medical record, EMR. Those two sets of data will be statistically evaluated and calculated to find if the intervention made significant changes in PHQ score, and the reduced PHQ scores after the intervention will provide evidence of the effectiveness of IDT collaborative care in reducing depressive symptoms. This project initially selected 56 PACE participants that meet the inclusion criteria. Inclusion criteria includes age 55 and older, attending the center activities more than 2 days a week for 6 months, receiving pre-interventional PHQ tests and post-interventional PHQ tests after 6 months of intervention. To determine the effectiveness of the intervention, the samples that are participants must attend the community center at least 2 times a week and receive IDT collaborative care in one location for 6 months. At the end of the data collection, 7 participants were excluded because they were unable to complete post-interventional PHQ-9. The data from the remaining 49 samples were evaluated. About 95% of the samples are Hispanic whose main language is Spanish. For statistical data analysis, this project used Wilcoxon matched pairs test. The Wilcoxon matched pairs test is the statistical test that is well used to compare two sets of data, both representing the same characteristics of the samples. This test processes two data sets to compute the differences between two sets and ranks the value of differences from low to high. This test is valuable when the researcher wants to find out if the intervention makes significant changes in the first data set, pre-intervention, to produce the second data set, post-intervention. The data that was used for this project was PHQ-9 test scores. The PHQ-9 scores expresses the severity of depression ranging from 0 to 27. A score of 0 means denial of depressive symptoms. As the number is higher, the depressive symptoms are more severe. The level of severity is minimal if the score is 1 to 4, mild if 5 to 9, moderate if 10 to 4, moderately severe if 15 to 19, and severe if 20 to 27. Table 1 shows the result of Wilcoxon signed ranks test. Wilcoxon test statistically found that 34 out of 49 samples reported reduced depressive symptoms. 7 out of 49 samples reported increased depressive symptoms, and 8 out of 49 samples reported no changes. Sum of ranks is used to evaluate the significance. For Wilcoxon's calculation, showing in Table 2, subtracting pre-test result from post-test scores. This calculation found a z-value negative 4.478. This demonstrates that there is a difference between the two data sets. The negative value demonstrates that the post-test statistic value is lower than the pre-test statistic value. Wilcoxon generated a two-tailed asymptomatic significance, and the result was less than 0.001, demonstrating the probability value, which is p-value, to be less than 0.001. This result demonstrates that the result is statistically significant and provides strong evidence of effectiveness of the intervention. The histogram in graph 1 shows the comparison of the pre- and post-interventional PHQ-9 scores by the severity level. Blue represents the pre-test and orange represents the post-test. The orange bar is taller on no depression and minimal depression, while the blue bar is taller on mild depression and moderate depression. The descriptive statistics analyzed each data set to present the values of means and standard deviations of each data set. The mean value from post-interventional PHQ-9 is 2.82, which is lower than the pre-interventional PHQ-9 data set mean value, which was 5.84. This demonstrates the reduced mean value of PHQ score after the intervention. In the area graph in graph 2, the orange area represents the post-test PHQ scores, and the blue area represents pre-test PHQ scores. The left side of the area chart represents no or minimal depression, and the right represents moderate or severe depression. The people in the blue area on the right side moved or shifted to the orange area on the left side, demonstrating reduced severity of depression after the intervention. The results demonstrate strong evidence of the effectiveness of IDT collaborative care for 6 months in reducing depressive symptoms in older adults. Although the result found the effectiveness of IDT collaborative care, there are limitations in applying IDT collaborative care. It is the applying IDT collaborative care to the practice is finding a facility with 11 or more IDT members actively providing care for patients daily are not easy to find. And another limitation is the need for continuous care by IDT, as depression is a chronic disease and can get worse without proper care. The patients need to receive IDT collaborative care to maintain reduced levels of depression. So to minimize the limitation, the healthcare policy must support IDT collaborative care. The healthcare fund should be more available for IDT collaborative care, and the effectiveness of IDT collaborative care needs to be disseminated. The healthcare policy or acts that support IDT collaborative care for older adults are following: supporting Older American Acts of 2020, collaborate in an orderly, cohesive manner act, The project found sufficient evidence to show a difference in scores between the pre-test and post-test after older adults received IDT collaborative care for 6 months. The reported asymptomatic significance two-tailed test was less than 0.001. Hence, there was a statistical significance between pre-interventional PHQ-9 scores and post-interventional PHQ-9 scores. The result revealed that the intervention of IDT collaborative care for 6 months was effective in reducing depressive symptoms in older adults. The findings establish the importance of providing IDT collaborative care for reducing depressive symptoms in older adults. Reduced depressive symptoms with intervention suggests possible reduction of hospitalization, improvement of chronic disease, and better quality of people's lives. This project suggests great implication for nursing practice. The primary care provider is the main member of IDT. Nurse practitioners are prepared to provide primary care to patients of all ages. Nurse practitioners need to implement their transformational leadership to conduct interprofessional team-based care that meets patients' needs and improves the quality of patient care. The implication of IDT collaborative care can be well conducted by nurse practitioners, as the nurse practitioner is eligible to take the role of a PCP and lead IDT collaborative care. So depression is known to be associated with various chronic diseases. If depression is improving, that means their chronic disease will be improving as well. So the implication for future research can be following. Would IDT collaborative care be effective for lowering hemoglobin A1C in diabetes patients? Would IDT collaborative care be effective for reducing the hospitalization of patients with CHF? Would it be effective for reducing weight in patients with obesity? Reduced depressive symptoms may potentially reduce comorbidities. Another suggested implication is to study the effectiveness of IDT collaborative care for other populations, as this project was done in a facility with about 95% of immigrants from South America speaking Spanish. Further research is recommended to be done for other populations such as Asian populations or mixed populations. In conclusion, this project taught us old adults are vulnerable to suffering from depressive symptoms, and depression in older adults is associated with falls, worsening chronic diseases, disability, and suicidal death. And it is recommended that all older adults need to get screened for depressive symptoms and receive treatment. If depression is underdiagnosed or not treated, it can cause worsening arthritis, diabetes, hypertension, congestive heart failure, and poor quality of life. Because of the complex causes and symptoms of depression, a multidisciplinary team approach or interdisciplinary team collaborative care should be implemented. The project provided strong evidence of the effectiveness of IDT collaborative care in reducing depressive symptoms. This quality practice must be disseminated so that all facilities that provide IDT collaborative care, which will improve quality care and improve the quality of patients' lives. And these are the references that were used for this presentation. This is the end of my presentation. Thank you.